Welcome to the Toyota Green Room. We are talking your heart health with Dr. Narula. Welcome.
Yes, my favorite topic.
It is your favorite topic. And why are we not as knowledgeable as we should be in terms of our bodies and how our heart is impacted by the everyday stresses that we deal with? I mean, why don't we know this is the #1 killer of women?
I know. And despite the fact that we've been educating women since 2004 with the Go Red for Women campaign, we still have this big gap in awareness. Women just don't think about heart disease and stroke as a threat to them. They think about cancer a lot of times, but when you look at the statistics, about 1 out of 3 women will die of heart disease, 1 out of 30 will die of breast cancer. More women die of cardiovascular disease than all forms of cancer combined. So it really is a big problem that more women don't appreciate that. But in addition, they don't really know the symptoms or how to recognize them. They don't understand risk factors and how to manage them. So we have a lot more education we need to do.
Are we doing better, though?
We're doing better, no doubt. And I think a lot of these educational and awareness campaigns have accomplished a lot in terms of saving women and making them healthier, but we still have much more to do. So that's why the days like this, where we wear red and raise awareness and tell our stories, it's really important.
So what should women know? What are the signs?
Right. So a lot of times, unfortunately, with heart disease, it can be silent. And that's one of the things that makes it so deadly. So you can feel well and you can have high blood pressure or high cholesterol or diabetes or plaque in the arteries that supply blood to your heart, and you don't know you have it until the day you have your first heart attack or stroke. So that makes it difficult, and I think that's one of the problems with cardiovascular disease. But if you do have symptoms, by far and away, chest pain, most common symptom for women, but it doesn't have to be the kind where you clutch your chest and fall over on the floor, and it's horrible.
It's subtle.
It can be subtle. It can be kind of up here in the chest. It can be more down here.
Like indigestion.
Right. So some people say, I have indigestion, and that's all it is, and they don't really get it checked out. But then women can also get things like shortness of breath, fatigue, lightheadedness, feeling kind of sweaty or clammy, arm pain, jaw pain, or back pain. So some of these other symptoms that may not make them think I should have my heart checked out.
Those are also symptoms or what we associate with anxiety.
It can be. And I can't tell you how many women have come into my office and said that they've seen other doctors and their doctor told them that they're just anxious or stressed. Yesterday I had a woman in my office and she said, I can't walk more than 3 blocks before getting short of breath, and I'm coming to see you because the last person I saw told me I'm depressed and I need to see a psychiatrist. So unfortunately, in the medical community, we have not always taken women's complaints seriously, and that has contributed to the problem.
At what age should we start seriously taking a look at our vitals?
Earlier than I think a lot of people think about. So the recommendation by the American Heart Association, for example, is to start having your blood pressure and your cholesterol checked as early as age 20. So a lot of people in their 20s and 30s are not thinking about this. And one thing I think that women can really do that would be helpful is what happens to women during pregnancy can be a marker of their future risk.
Really?
Yes. And so we know women go every year to get their pap smear. They get care, with their OB-GYN, and that's a great time to think about what might be happening with my cardiovascular system. So if they have preeclampsia or gestational diabetes or gestational high blood pressure, or even babies that are low birth weight, all of these things can signal that they might be at increased risk down the line. So the OB-GYN's office is actually a good place for women to start the conversation.
Is that because of the stress of the baby on your system?
It's kind of like a stress test. Exactly. Exactly.
So I want to know, for someone who has notoriously low blood pressure,
Yes. That's good.
cholesterol in check, and all of a sudden you go to the doctor and you see all of a sudden a spike in your blood pressure, a spike in your cholesterol measuring, and you've hit that certain age. Is that the time when you need to be concerned and say, okay, this is where I really need, the rubber meets the road?
Yeah, I mean, cardiovascular disease is all about prevention, because it takes time, in some cases, for the problem to occur. So for plaque to build up in the arteries, it doesn't happen overnight, it's over years. And so all the things that you're doing ahead of time to kind of prepare and plan and keep your numbers down and in the right range are really important to prevent that first event like a heart attack or stroke from ever happening. So certainly we know that risk for women goes up over the age of 55 or when they're postmenopausal. That's kind of the age cutoff. And then we think about things like family history. So you may have a normal blood pressure and great cholesterol levels, but if you have a very strong family history of early heart disease, that's something that we need to know as your doctor because it plays into your risk.
And if your parents or grandparents died from the disease?
Yep, so we look at the whole family tree, but in particular we pay attention to what we call first-degree relatives, meaning your parents or your siblings. And we look to see, did a woman, a first-degree relative, have an early heart attack or stroke before the age of 65? Did a man have an early heart attack or stroke before the age of 55? And if they did, that's a marker for high risk.
What are the biggest risk factors you can avoid?
So high blood pressure, one of the biggest. Abnormal cholesterol levels, so a high LDL or bad cholesterol, a low HDL or good cholesterol. Diabetes. Diabetes is a big, big risk factor. And then smoking. So those are kind of the big ones. And then you think about things like obesity, lack of exercise, stress, too much alcohol. These are kind of the traditional ones that we look at. What's interesting for women is they have a lot of these ones that we don't often talk about that can put them at higher risk. So things like polycystic ovarian syndrome. We talked about pregnancy issues, early menopause, migraines with aura, women who have autoimmune disorders like lupus or rheumatoid arthritis or even psoriatic arthritis. All of these things can, and mental health I didn't mention, but very important, depression, anxiety, these can all play into elevating a woman's risk of cardiovascular disease.
And why is that?
We don't know, for a lot of these reasons, the exact pathophysiology or mechanisms. We're learning about it. In some cases, for example, with stress, we know that you have a release of a lot of these fight or flight hormones, stress hormones like cortisol. That can increase inflammation. That can increase your blood pressure and your heart rate. So for some of them, we have an idea of the pathway. For others of those risk factors, we're still figuring it out.
And what's the best thing you can do for yourself?
The best thing you can do is to have what we used to call it, or what we call a well woman exam, where you basically go to see your doctor, you find out your numbers, and you talk about your risk. You have your doctor sit down and say with you, Michelle, your risk of a heart attack or stroke in the next 10 years is 2%, or it's 20%. And then you figure out a plan. What do you need to do? I need to lose weight, I need to exercise, whatever it is for you. And sometimes it includes medication, things like aspirin or cholesterol-lowering medications or drugs to treat hypertension. But really, I think it's just putting the idea in your head that this is something I need to pay attention to. Even if I feel well, even if my numbers are good, I should have this on my radar at the top of my list of things that should be a priority.
Because there's no quick fix.
There's no quick fix, and unfortunately women tend to prioritize themselves last on the list. Husband, kids, work, everything else is first, and they really many times ignore a lot of the symptoms they're having for a while, and that can be problematic because, for example, we know that this damage can happen over time for a lot of these diseases, and then once you have a heart attack, those cells start to die. They don't come back. They don't regenerate. And so you form scar tissue that can put you at risk for heart failure. So always better to catch things earlier to start to treat them earlier.
Prevention is key.
It is.
Glass of wine in there? Red wine?
Glass of wine is, I actually think, not a bad thing. We do say that as a woman, you're allowed 1 drink a day.
Really?
You are. And so I actually tend to tell my patients if they're going to choose a drink, red wine is a good choice because it has flavonoids in it, which is the same compound in dark chocolate that kind of tends to help blood vessel health.
Dark chocolate good too?
Dark chocolate and wine. You can have
Hello,
Michelle. You can go home tonight.
And that is your heart health with Dr. Narula. Thank you so much.
Thank you, Michelle.